Imagine this. It is 2 a.m. The house is completely still, and then you hear it. That tiny, wet crunching sound coming from your cat's mouth. You know exactly what it is. Your cat has been pawing at their face, dropping kibble out of one side of their mouth, and giving you that heartbreaking look like they want to eat, but something hurts. I know how terrifying it is to peek under your cat's lip, see that angry red line creeping up the side of their teeth, and feel completely powerless. And I know how frustrating it is to be told the only real answer is to brush their teeth every single day, which feels flat out impossible when your cat treats a toothbrush like it's a declaration of war. But what if I told you that you don't need to wrestle your cat into a headlock every night, and you don't need to spend $600 on a vet dental cleaning every 12 months just to keep their mouth from rotting? What if I told you that the secret to a perfectly clean, healthy, pain-free cat mouth is built right into their daily bowl, their chew toys, and a few simple swaps you can make at the grocery store? If you saw the thumbnail of this video, you saw the promise. Today, I am going to show you exactly how to keep your cat's teeth clean, healthy, and odor-free without brushing them every single day. Hi everyone, I'm Dr. Logan Wells Buffington, your neighborhood veterinarian, and welcome back to the channel. In my clinic, feline dental disease is hands down one of the most heartbreaking things I see, because by the time a cat lets you know their mouth hurts, the damage is already done. Cornell's Feline Health Center tells us that somewhere between 50 and 90% of cats over the age of 4 have some form of dental disease, and a separate study showed that up to 70% of cats develop tooth resorption, those mysterious holes in the teeth that turn into catastrophic fractures. We are taught to just schedule a $600 cleaning under anesthesia every year and brush their teeth or the problem will spiral. But as a holistic-leaning vet, I believe we can do so much better than that. Now, I know a lot of you have older cats or rescue cats who will simply never allow a toothbrush anywhere near their mouth. I actually just posted a whole video dedicated to my favorite raw food swaps for fussy cats. If your cat refuses every chew and turns up their nose at new foods, definitely go check out that previous video after this. But in today's video, we are going to focus entirely on cat teeth, that telltale cat breath, and exactly how to stop the slow-burning inflammation that destroys their mouth from the inside out. So, today we are doing a complete masterclass on building your cat's dental health from the inside out, from their bowl to their chew toys. Grab a notebook because I am going to give you a simple, practical guide on how to scrub their teeth on the outside without ever picking up a brush, and then how to rebuild their mouth and their gums on the inside. Let's start with step 1. Before we can fix the inside of the mouth, we have to give your cat immediate relief. We have to put out the fire. When a cat is suffering from dental disease, their gums are quite literally on fire. They are inflamed, angry red along the gum line, and the tissue is bleeding or receding away from the teeth. The first thing we need to do is bring the bacterial population under control, because the enemy in every feline mouth is not the tartar you can see. The enemy is the invisible sticky biofilm called plaque, and underneath that plaque lives all the bacteria that drive the inflammation. The single most powerful, no-brush tool I use with my hardest feline cases is a clinically studied water additive. You simply add a tiny capful to their drinking water every single day. The active ingredient is a naturally derived compound called pomegranate, or in some formulas, a seaweed called Ascophyllum nodosum, and dozens of peer-reviewed studies show that cats drinking the treated water have measurably less plaque and freshened breath within weeks. But please hear this vet warning. A water additive is not a magic potion. If your cat is already refusing to eat, drooling, or pawing at their face, the bacteria have already won the battle in their mouth. You must get them to the vet. Paws with blood, loose teeth, and a cat who stops eating kibble is a medical emergency, and no amount of kitchen work is going to address a fractured tooth or a resorptive lesion. The water additive is for daily maintenance and prevention, not rescue. Now, what if your cat won't even tolerate flavored water? Or what if you have more than one cat and you can't be sure who is drinking what? You can use my second favorite no-brush tool, a topical dental gel or wipe. These products come in a small tube. You simply lift your cat's lip, smear a thin ribbon of gel along the outer surface of their upper molars, or wipe a pre-moistened cloth across those same teeth. The active enzymes go to work immediately, softening plaque and stopping the bacteria from sticking to the enamel. Most cats barely feel it because the formula is flavorless. Many cats actually think it is delicious. You can do it in under 5 seconds while they are half asleep on the couch. Now, what if your cat is one of those cats who absolutely refuses anything on their gums, who hates flavored water, and who runs every time you approach with a wipe? Do not despair. For these cats, we use a completely different mechanism. We use the mechanical scrubbing power of their dinner bowl, Science Diet Oral Care, and Hill's Prescription. Diet T/D are two of the very few dry kibbles in the world that have earned the Veterinary Oral Health Council Seal of Acceptance, which is the gold standard independent testing body for cat dental products. The kibbles are engineered with a special fiber matrix and a much larger kibble size, so when a cat bites down, the kibble does not shatter and fall in. It forces the tooth to sink deep into the piece before it cracks, mechanically scraping the plaque off the tooth as it sinks in. Published studies on these diets show up to a 39% reduction in plaque and a 36% reduction in gingivitis scores in just 6 months, and the cat never even knows it is happening. All it does is eat dinner. But listen closely, because this is a massive veterinary warning. Generic dental kibble from the grocery store shelf that has not been approved by VOHC has zero proven cleaning power. Most of them use a fancy texture that splinters the moment your cat bites it, so the tooth passes right through without any scrubbing at all. You must look for the VOHC seal on the bag. No seal, no proof. Now, alongside the dental diet, we want to add one more mechanical scrubbing element into their day. The second no-brush tool I love. Edible dental treats that have actually earned a VOHC seal. Feline Greenies, Purina Dentalife, and a few others have been independently shown in clinical trials to reduce tartar buildup. The key is the abrasive, scrubby texture of the treat itself. As your cat bites into it and gnaws, it literally scrapes the plaque off the sides of the teeth in a way that a soft, grain-free kibble cannot. Give 1 or 2 a day after their main meal when they are chewing enthusiastically. So, we've disinfected the water, we've added the food-based mechanical scrubbing, and we've softened the daily biofilm. Now we move to step 2. We are going to make their teeth physically stronger and rebuild the foundation of their mouth. Here's a fact most cat parents do not realize. Every one of your cat's teeth is anchored into the jawbone by a little ligament. If that ligament gets eaten away by chronic inflammation, the tooth becomes loose, painful, and eventually falls out. To keep those ligaments alive and stable, we have to feed the tissues that build them. Cats are obligate carnivores, which means they have zero biological need for carbohydrates, and this is incredibly important for their teeth. Every time your cat eats a dry kibble loaded with corn, wheat, peas, potatoes, or rice starches, that starch breaks down into simple sugar inside their mouth. Sugar is the exact food source the disease-causing bacteria inside plaque thrive on. The more sugar they have in their mouth, the faster they multiply, the harder they attack the gum line, and the faster the resorptive lesions begin forming. So, step number 2 is to dramatically reduce the starchy, sugary kibble in their bowl. I am not against kibble. The dental diets I just mentioned are kibble, and they are fantastic. But if your cat is currently eating a cheap, starch-heavy kibble as their everyday diet, the carbohydrate coating on their teeth 24 hours a day is slowly cooking their gums. Swap a portion of that kibble for a high-moisture, high-protein canned food, or better yet, a biologically appropriate raw or gently cooked wet food. Wet food does not paste itself onto the teeth the way kibble does. It slips past the gum line without feeding the bacteria, and the high moisture content flushes the mouth every time they swallow. Now, the second half of rebuilding their teeth from the inside out is fat-soluble vitamins. In particular, vitamin D and the omega fatty acids. Vitamin D is the master regulator of calcium in the body. If your cat is deficient in vitamin D, their tooth enamel can become thin, chalky, and brittle, and their jawbone can soften, which makes loose teeth far more likely. Most cats who eat a balanced commercial diet get enough, but if you are feeding a homemade or raw diet, please work with a vet to make sure the vitamin levels are correct. Omega-3 fatty acids, the same fats you hear about for heart and skin health, are absolute miracles for cat gums. They are powerful natural anti-inflammatories. They calm the angry red gum line from the inside out. They reduce the immune overreaction that makes the gums bleed every time your cat bites a piece of kibble. My favorite, cheapest way to deliver a therapeutic dose of omega-3s to a cat is a tiny, half-teaspoon dollop of wild-caught salmon oil poured over their dinner 2 or 3 times a week. It smells like the ocean. Most cats love it, and the anti-inflammatory effect on the gums is profound. You will see the difference in their breath within a few weeks. There is one very important safety rule with fish oil. Always buy a high-quality, refrigerated, mercury-tested product designed specifically for cats. And never give them human fish oil capsules that may contain essential oils like peppermint or wintergreen, both of which are genuinely toxic to felines. So, we've calmed the outside, we've rebuilt the inside. Now we must move to step 3, the long-term defense system. My friends, the biggest, most heartbreaking feline dental disease is not just gum disease. It is something most cat parents have never heard of. It is called tooth resorption, or FORLs. Cornell Feline Health Center and a wide range of studies confirm that somewhere between 30 and 70% of adult cats will develop at least one resorptive lesion, and the older the cat, the higher the risk. A resorptive lesion is a mysterious hole that the cat's own body eats into the tooth from the inside out, starting at the gum line, and eventually the tooth simply snaps off at the root. It is agonizing, and the worst part is, it is almost impossible to spot at home without an X-ray. So, the long-term defense system for your cat's mouth starts with 2 simple habits. Habit number 1, monthly mouth inspections. Once a month, gentle cat owners, please take 30 seconds and lift your cat's upper lip. Look at the back molars and the canine teeth. Is the gum line a beautiful pale pink, or is it angry red and bleeding? Do you see any small pinkish spots at the gum line, like a tiny bruise on the side of the tooth? That pink dot is almost always the beginning of a resorptive lesion. Also, lift the lip and smell your cat's breath. I know it sounds silly, but a healthy cat mouth has very little odor. If your cat's breath makes you recoil and smells sour or rotten, there is almost certainly an active infection brewing that needs a vet. Habit number 2 is the regular VOHC seal-approved dental treat, not just as a snack, but as a daily maintenance tool, 1 or 2 a day, the brands with the actual seal on the package. Among the very few that earn that seal are Feline Greenies, Purina Pro Plan Dental Bites, and Whiskas Dentabites. These are proven in independent trials to scrape off soft plaque before it hardens into permanent tartar. And finally, the third habit is the most important of all. Twice a year, lift that lip, smell that breath, and slip into your vet for an exam. Your veterinarian is the only person who can spot a resorptive lesion early enough to save the tooth or at least prevent months of silent pain. Wow, we have covered an enormous amount of information today. Water additives, VOHC seal diets, enzymatic gels, salmon oil, VOHC seal treats, monthly mouth inspections, and wet food swaps. I can imagine you might be feeling a little overwhelmed, wondering how on earth you were supposed to put all of these things into a single household with one stubborn cat. My friends, here is the golden rule. You do not need to use all of these at once. If you suddenly dump fish oil, a new dental diet, a new water additive, and 3 new treats on your cat tonight, I guarantee you they will refuse them all and you will feel defeated by morning. The beauty of feline health is that cats are creatures of tiny, slow adjustments. To make this perfectly easy, I want you to use my bowl formula. Every day when you feed them, you only need to add 3 small things. Week 1, swap 1 meal a day from starchy kibble to a high-quality wet food and add just 1 capful of VOHC-approved water additive to their bowl. Week 2, layer in 1 enzymatic gel smear on their back molars while they sleep. Week 3, add a single VOHC seal-approved dental treat to their nightly routine. That's it. You do not need to do anything else. You rotate these simple, cheap kitchen and pet store additions week by week, and you let your cat tell you what they like, because forced change is what makes cats hide under the bed. It takes exactly 10 extra seconds a day to prepare, but I promise you, if you stay consistent with this simple action plan, you will dramatically reduce the bacterial load in their mouth. You will strengthen their enamel. You will catch problems before they become emergencies. And you will watch your precious, secretly uncomfortable cat start thriving without ever having to wrestle a toothbrush into their face. Protecting your cat's teeth is one of the most loving, quiet things you can do as a pet parent. It does not get the same recognition as a vaccination or a surgery, but by choosing to educate yourself and adding these small daily habits to their routine, you are proving how deeply you pay attention to their silent suffering. If this masterclass gave you hope today, and if you are excited to try these no-brush remedies, please do me a huge favor and hit that like button. It helps tell the algorithm that this holistic, safe veterinary advice is valuable, and it helps our channel protect so many more cats. So make sure to hit subscribe so you never miss our deep dives into your cat's health. And please, leave me a comment down below right now. I want to know, does your cat have that telltale stinky breath, or have you already spotted red gums along the gum line? And which of these no-brush tricks are you going to try first? I try to read every single comment, and I love seeing our community support each other. Give your sweet, beautiful cat a gentle chin scratch from Dr. Logan tonight. Stay safe, always trust your instincts, and I will see you all in the very next video.